Most athletes think muscle growth and recovery hinge on training harder. Hidden behind every record-breaking physique is a world of specialized peptides, some clinically trialed, others flying under the radar, that can slash injury time, amplify fat loss, and ignite rapid strength gains. Yet, despite explosive results and claims of up to 10% extra muscle, most lifters have no idea which peptide truly changes the game. What makes these molecules so powerful, and which ones actually deliver in the gym? EPC-157 enters the spotlight as the body's repair specialist, often compared to a pit crew for injured athletes. This peptide works behind the scenes, accelerating recovery by supporting new blood vessel growth, a process called angiogenesis. In a clinical case series, 12 people with stubborn knee pain received a single injection near the injury. 10 of them reported full relief and 2 described major improvement, with benefits lasting over 6 months. For lifters eager to get back under the bar, BPC-157 offers hope for faster rehab and less downtime. While early results are promising, medical oversight is essential because research is still in its early stages. TB500 steps in as the cell's own scaffolding technician, working inside muscle fibers to restore structure after grueling sessions. This synthetic peptide is modeled after thymosin beta-4, and it specializes in actin remodeling, a process that lets cells move, repair, and rebuild damaged tissue more efficiently. In animal studies, TB500 sped up wound healing by boosting collagen formation by over 60% within a week. That translates to less stiffness and improved flexibility, and athletes pushing high volume can recover range of motion faster. While these results are promising in preclinical models, there is still no direct human data on mobility or muscle repair. All claims remain experimental. Stacking BPC-157 and TB500 is popular among athletes aiming to cover both sides of tissue repair, vascular and cellular. BPC-157 supports new blood vessel growth, and TB500 targets the internal scaffolding of muscle fibers. Together, this combination is used to address complex injuries, from stubborn tendon strains to deep muscle tears, by tackling multiple repair pathways at once. Most of the supporting evidence comes from small human case series and animal studies, with direct human trials still missing for TB500. This leaves a gap between what is observed in the lab and what is proven in real-world training. So proactive users weigh potential benefits against the lack of large-scale clinical data. CJC-1295 operates like a metronome for the body's growth hormone system, creating a steady rhythm of release instead of sharp peaks and valleys. As a growth hormone-releasing hormone analog, it signals the pituitary to pulse out growth hormone in a controlled, sustained pattern. This approach is designed to support fat metabolism, especially around the midsection, while helping athletes preserve muscle during calorie deficits. Fighters aiming for body recomposition often look to CJC-1295 for its potential to maintain lean mass as the scale moves down. While the mechanism is clear, steady pulses that favor visceral fat breakdown, direct clinical evidence in healthy lifters is still missing. Most of the reported benefits rely on theory and user experience, so medical oversight remains important. Ipamorelin stands out for athletes who want recovery support without the side effects common to other growth hormone secretagogues. This peptide acts as a ghrelin receptor mimic, nudging the pituitary to release growth hormone in short, natural pulses. Unlike older compounds, Ipamorelin rarely causes a surge in appetite or water retention, making it a favorite among lifters over 35 years old who are focused on controlling their diet. Its effects are transient. Growth hormone rises for a few hours after dosing, then returns to baseline. While direct muscle building evidence is limited, many people report better sleep, faster recovery, and a smoother path to maintaining lean muscle during hard training cycles. Follistatin 344 enters the discussion as the peptide that takes the brakes off muscle growth. In the body, myostatin acts as a natural limiter, keeping size in check. Myostatin signals tell the body when to stop growing. Follistatin 344 blocks that signal, allowing muscle fibers to grow beyond their typical boundaries. In animal models, myostatin inhibition led to striking hypertrophy. Mice treated with follistatin gained up to double their usual muscle mass. For lifters stuck at a plateau, this concept is like finding a hidden lever for size gains. But there are no direct human trials, and the risk of unchecked growth means the hype must be balanced by caution. For now, Follistatin 344 stands as the bold option in the hypertrophy toolbox, promising big rewards for those willing to tread into experimental territory. IGF-1 LR3 stands out for athletes chasing raw strength and new muscle growth. This peptide is a modified form of insulin like growth factor 1, engineered to resist breakdown in the body and stay active for hours rather than minutes. That extended half-life means muscle cells are exposed to anabolic signals far longer, fueling both protein synthesis and the creation of new muscle fibers, a process called hyperplasia. For lifters pushing for bigger lifts and denser physiques, IGF-1 LR3 supports the kind of cellular change that underpins lasting strength gains. Its impact depends on consistent, heavy training, because the peptide amplifies the body's response to resistance, not just rest. GHK-Cu, the copper peptide, is gaining attention for supporting the body's natural collagen framework. Collagen is not just for skin. Athletes rely on strong connective tissue to handle heavy loads, explosive movements, and repetitive strain. Studies in cosmetic research show GHK-Cu can upregulate collagen production and help reinforce tendons and ligaments that anchor muscle to bone. This molecular support acts as a foundation for long-term performance, especially for lifters who want to stay strong and pain-free year after year. Most data come from topical applications and skin repair, but the principle of collagen enhancement appeals to anyone focused on durability and longevity in training. Direct evidence in athletes is still limited. Practical use should always be paired with proven recovery methods and with medical guidance. Comment: which peptide you want explained next for muscle growth, recovery, or fat loss? Epitalon, sleep quality and recovery optimization. A peptide inspired by the pineal gland's natural rhythms, Epitalon has drawn attention among athletes seeking better sleep and faster recovery. By activating telomerase, it supports cellular repair and is linked to deeper, more restorative sleep. Reports from users describe falling asleep quickly, fewer nighttime awakenings, and vivid dreams. While large-scale studies are lacking, smaller trials and anecdotal evidence point to improved recovery and readiness. Epitalon's role in boosting melatonin and resetting the body's internal clock makes it especially appealing for those facing overtraining or disrupted schedules. For many, it has become a trusted part of the nightly routine, promising a chance at real rest when it is needed most. Right now, peptide use is outpacing clinical research. For every new compound, the line between breakthrough and risk gets thinner. In fitness, progress is science, but safety is still your call.